everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about how to classify heart failure. So we're going to talk about the New York Heart Association, and we're also going to talk about the American College of Cardiology, which is the American Heart Association. They have their own guidelines as well. So the first one is probably, I would think, the most famous one, the most popular and well-known one, which is the New York Heart Association guidelines. Okay, so they have 4 classes, and they define them as Class 1, no limitation of physical ability. So you're having no symptoms with activity. Class 2, now there is a slight limitation of physical ability. So these patients will start to experience like dyspnea on exertion or fatigue. Not during like everyday activities, they're fine, but if they have to do anything to exert themselves, maybe like run up a flight of stairs or, run after the dog or something like that, they're going to feel really short of breath and winded and fatigued from that activity. Class 3, now we actually have a marked limitation of physical ability. So this is even doing like everyday tasks, okay? Just, walking around your house, doing something like vacuuming. This is too much, okay? This is going to show a lot of people having symptoms like fatigue, like shortness of breath. They need to sit down, take a little break, just from doing simple everyday things. And then the final one, Class 4, this is the worst, this is the most severe. And these patients experience shortness of breath even at rest. So all of these other ones, we've been talking about activity, right? They're actually like doing things, right? So the first one, they can do things no problem. The second one, now they're starting to feel a little tired or a little, winded with like really strong activity. Here, now they're starting to feel those symptoms with, everyday ADLs and activity. For this one, they're not even doing anything, okay? So they're resting, they're sitting down, they're relaxing, and they're still having a hard time, okay? So this is absolutely the most severe. This is Class 4. And the New York Heart Association is the most commonly used one, but there is another one that is also very commonly used and very popular and important, so you need to know it, and that is the American College of Cardiology American Heart Association guidelines. So let's talk about those. The second classification scale we use is from the American Heart Association and the American College of Cardiology. This one goes by letters, so A, B, C, and D. So the first one is A, and the criteria in classification A are having risk factors for heart failure, but no current signs and symptoms that indicate heart failure, or no structural heart disease presently. So some examples of this can include having high blood pressure, so hypertension, and then obesity. And then what is our treatment of choice at this point? Depending on where you're at, right? Control those risk factors like this stuff, okay? Kind of get it under control with, diet and lifestyle. Or ACE inhibitors if you already have, the high blood pressure. And if you can't have ACE inhibitors, ARBs. So that's classification A. Now let's talk about classification B. For this one, the patient has heart disease, like a structural heart disease already, but no signs and symptoms of heart failure. This can include a history of an MI, so a myocardial infarction, a heart attack, so there's already been some damage to their heart previously, or left ventricular hypertrophy. So these are some examples of the patient having heart problems, but not technically signs and symptoms of heart failure yet. And what can we do about it? So controlling risk factors, just like in stage A, and then ACE inhibitors or ARBs, again, just like in classification A. But now they want to start adding beta blockers to the treatment plan. So that's B. Let's talk about C. For classification C, now our patients are actually having those signs and symptoms. So the criteria for this one is the patient who has heart disease and is having or has previously had the signs and symptoms of heart failure. Some common ones I put in the examples here, so that could be the patient complaining of shortness of breath or fatigue. And our treatment options, there's lots of options now. So just like before, right, controlling risk factors, that's always going to be number one. But now we have ACE inhibitors, ARBs, beta blockers, diuretics, sodium restriction. For some people, cardiac resynchronization therapy, and for even other people, implanted defibrillators. So now we got a lot more options for treatment because now we've gotten a lot more serious, okay? So this is classification C. Now they're actually having those symptoms of heart failure. And the last one is classification D. So these are people who are very, very sick. So the patient has advanced heart failure requiring specialized treatment. And for this one, they have all of the symptoms, they're experiencing symptoms even with the treatment. So the treatment isn't enough at this point. When it comes to the treatment, it's a lot of the stuff we did in classification C. So controlling risk factors, ACE inhibitors or ARBs, beta blockers, diuretics, sodium restriction, possible cardiac resynchronization, an implanted defibrillator. But now we're adding end-of-life care and then possible heart transplant. So we're pretty serious now when we're in classification D. And if you're wondering, like, okay, we have the New York one, we have the College of Cardiology one, which one of these do we use? Actually, it's important to know both because oftentimes they are used together, okay? So the physician will use both of them to kind of figure out what's the best plan of action for treatment for that patient. So it's not like one is more important or one is better than the other. They actually both get used together. So I hope you found this video helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.